This assessment was the place where we got all of the numbers that we needed to take a look at. And we didn't gather any primary data. We went to secondary sources, places where information already existed to get that. We worked with a consultant from the John Snow Institute at their Community Health Institute to work with them to get the numbers out of the various systems that exist for us to look at. In your binder, there is some information, more detailed information about the methodology, but I wanted to point out that we really, at this point in the MAPP process, wanted to get some baseline data so that as we go on with this process in 2 to 4 years, we would be taking a look at some of these numbers again and seeing how our actions in the meantime have been able to move those numbers either up or down in a better direction for our health in York County. And we pulled out a few of the pieces of data for you to take a look at. York County's median household income is higher than Maine's and higher than the national average. And I think that this number points to a theme that was pointed out previously in the Forces of Change, that there really exists two Maines, and that some of the demographics of folks who live in the north of Maine and those that live in the southern part of Maine can be very different. We found that the Choose to Be Healthy service area in the very most southern part of the state had the highest percentage of adults with a high school education. One of the pieces of information we found out about York County or York District is that we have a higher rate of children with disabilities than Maine and the nation. And we were talking a little bit about what could lead to that, and part of it might be because we have very good services in our schools to be able to help people and children with disabilities, so that it could be that people move to our area in order to get those services. Also, Coastal Healthy Communities service area has the largest population in our district. In terms of health indicators, we were, of course, very interested in the influence of tobacco on our health, and we did find that lung cancer is the leading cause of cancer death in our district. And still, we've come a long way in decreasing the rates of smoking for both adults and adolescents, but these rates are still, I'm sure you would agree, higher than we would like them to be. Nearly 22% of adults in York County smoke, and a little over 12% of our teens smoke. Hopefully, this is showing us that when these adolescents become adults, we'll have a lower adult smoking rate. All of the Healthy Maine partnerships do work on substance abuse prevention efforts, particularly for underage drinkers and drug users, and we thought it was important to look at from our student data how many students are using alcohol, and this is one of the questions in the survey that they take, and we found that 28% of 6th to 12th graders are reporting using alcohol in the last 30 days. 30%, almost a third of our 12th graders report binge drinking in the last 2 weeks. So that is showing us that number one, when teenagers get alcohol, they drink a lot of it, and that's not news to those of us in public health. We know about that. But number two, there's still a lot of teens that are using alcohol. The other thing that I'll point out here around our high school age students is that we know that we have a prescription drug abuse problem in York County. Our law enforcement partners would echo that, and so would our school partners, so that's an area that we need to look further at. And then we also know that having a healthy weight and the obesity rate is a concern for us in York County as well.